Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed in detail about vital signs, right, we've come to know that there are four measurements. That is the body temperature, the pulse rate, the respiration, as well as the blood pressure, right? And also, if you have viewed my previous videos, then I am sure by now you guys might have got a detailed idea of what is body temperature, of what is pulse, and what is respiration, right? So in today's session, we are going to deal with the last and the fourth measurement, that is the blood pressure. So in today's session, I'm going to teach you about what do we mean by blood pressure, about the physiology of blood pressure, about the factors affecting, as well as the alterations in the blood pressure of an individual. So without any further delay, let's start with the topic. So blood pressure. As we all know that blood pressure is defined as the force which is exerted by the blood against the wall of the blood vessels, right? And this blood pressure also includes two measurements, which is the systolic blood pressure as well as the diastolic blood pressure. So what do we mean by systolic blood pressure? By systolic blood pressure, we mean the force which is exerted by the arterial wall during the systole. And this systolic blood pressure is also the maximum pressure which occurs during the contraction of the ventricles. So when there is contraction of the ventricles, there will also be a maximum pressure, right? And this pressure will be recorded as the systolic blood pressure of an individual. Whereas diastolic blood pressure is also the force which will be exerted by the arterial wall during the diastole, and also this diastolic blood pressure is the minimum pressure which we will be getting when the ventricles are relaxed. So here what happens is that when the ventricles are contracted, there will be a maximum pressure, and that pressure will be known as the systolic blood pressure, whereas when the ventricles will be relaxed, there will be a minimum pressure, and that pressure will be known as the diastolic blood pressure. And also, whenever you assess and whenever you record the blood pressure of an individual, it is necessary that you must also write the unit. So here the unit of the blood pressure of an individual is mmHg, which means millimeter of mercury. And also here the normal blood pressure of an individual is 120 by 80 mmHg, where 120 is the systolic blood pressure and the 80 is the diastolic blood pressure. And also there is one more term that is known as the pulse pressure. What is this pulse pressure, right? This pulse pressure is the difference between the systolic and the diastolic blood pressure. So here, since I said difference, right? So how can you calculate this pulse pressure of an individual? As I've said that the normal blood pressure is 120 by 80, where the systolic is 120 and the diastolic is 80, right? So 120 minus 80 equals to 40. And this is also the normal pulse pressure of an individual, okay? Now next, moving on to the physiology of the blood pressure. So as we all know that in order to get the correct value of the blood pressure of an individual, we need to know the cardiac output and the peripheral resistance, right? So how will you know the cardiac output? You will only get to know the cardiac output only if you know the stroke volume and the heart rate of an individual, right? So here, in order to clear your confusion, I would like to say that the cardiac output is defined as the amount of blood which will be ejected by the heart in 1 minute, whereas the stroke volume is defined as the amount of blood which will also be ejected by the heart, but in one cycle. So do not forget this and don't get confused. If we talk about cardiac output, it means the amount of blood which will be ejected, okay, by the heart, but only for 1 minute, okay? Whereas the systolic volume is the amount of blood which will be ejected by the heart, but in one cycle, okay? So don't forget this. And also the blood pressure basically depend on the cardiac output and the peripheral resistance. That is why we must know these. Okay, that is why I have said that in order to get an idea of the blood pressure of an individual, we first need to know the cardiac output and the peripheral resistance. Why? Because the blood pressure depends on these two factors. And also here, the blood pressure may increase with increase of the blood volumes in the blood vessel. Okay, so here the blood pressure of an individual will increase if there is an increase in the blood volume which will be present in the blood vessels, and if this occurs, then there will also be an increase in their resistance as well. And this would also ultimately lead to an increase in the heart rate of an individual. So here normally the stroke volume of an individual is 70 to 80 ml. Okay, so here if there is, if the blood volume, if the stroke volume of an individual is, higher or lower than this, then this can lead to fluctuation in the blood pressure of an individual. And then the next one is the peripheral vascular resistance. So as we all know that the blood flows from the aorta to the arterioles, right? So what happens is that there will be a decrease in the pressure, right? So here also these arteries, these arterioles, they consist of smooth muscles. Okay, so these smooth muscles, what they do is that they help in changing the size of the lumen. So this peripheral vascular resistance, what they do is that they act as a resistance to the blood flow, which can be determined by the tone of the vascular muscles as well as the diameter of the blood vessels. So what happens here is that the smaller the lumen, the greater will be the resistance, and ultimately this will lead to an increase in the blood pressure of an individual. That is why vasoconstriction leads to an elevation of the blood pressure. So I hope you guys have understood about what does this peripheral vascular resistance do. Now then, moving on to the next one, that is the blood volume. So as we all know that the volume of the blood will be present in the vascular system, right? So what happens is that as soon as the blood volume will increase, then the pressure which will also be exerted against the arterial wall will also be increased. That is why when we encounter a client who is suffering from hypertension, we provide them with intravenous fluid. Why? In order to, increase their blood pressure. However, if you encounter a client who is suffering from conditions such as hemorrhage or such as bleeding, then what happens is that the blood volume will be decreased, right? Because of this condition, and because of the decrease in the blood volume, this will ultimately lead to a decrease in the blood pressure as well. And then the next one is the viscosity. So here from the name itself, you can understand, right, that viscosity refers to thickness, right? Thickness of the blood. So what happens is that the greater the thickness or the greater the viscosity of the blood, then the blood will start flowing slowly, and also the heart contraction will be more forcefully, and this would ultimately lead to an increased blood pressure. And the last one here is the elasticity. So elasticity is defined as the ability of the arterial wall to expand, right? So here, the greater the elasticity, the greater the arterial wall will be able to expand its diameter, and when it is able to do so, this will lead to a less resistance, which would ultimately lead to a low blood pressure. So this is the physiology of the blood pressure, which includes first thing, that is the cardiac output and the peripheral resistance, then the peripheral vascular resistance, and then we've talked about the blood volume, the viscosity, as well as the elasticity. Now moving on to the next, that is the factors that affect the blood pressure of an individual. So here there are various factors that can affect the blood pressure of an individual. It can be their age, it can be because of certain emotions such as stress, it can be because of ethnicity, it can be because of the diet of the food which they consume on a day-to-day basis, it can be because of the habits of smoking, it can also be because of the exercise, of the meditation, or even because of the chemicals. So in order to get a clear idea about how these factors can affect the blood pressure of an individual, let us discuss each one of it in detail. So the first one here is the age, right? So here the blood pressure of an individual will vary throughout the age. So here, with an increase in the age of an individual, the blood pressure will also be increased. For example, in infants, the normal blood pressure is between 42 to 80 mmHg, whereas if you assess the blood pressure of a child who is 7 years of age, then the normal blood pressure is between 48 to 64 mmHg. And if you assess the blood pressure of a normal adult, then the normal blood pressure is 120 by 80 mmHg. So that is why I say that with increase in age, the blood pressure of an individual will also be increased. And here it does not only depends on age, but also it depends on the body size of an individual, because it is observed that if the body size of an individual is greater, or is larger, then this can also lead to a fluctuation blood pressure. And also here, if you compare between two child who are of the same age, but one is heavier and taller, whereas the other one is smaller and shorter, then you will find that the blood pressure between the two will also not match. Why? Because here their body size is different, right? So here, depending on the age and depending on their body size, the blood pressure of an individual can differ from one person to the other. The next one here is certain emotions such as stress. So here, if the client is suffering from anxiety, is suffering from fear, from pain, or is having any stress, what happens is that the sympathetic nervous system gets activated. And when the sympathetic nervous system gets activated, then what happens is that it causes the vasoconstriction. And because of this vasoconstriction, it will lead to an increase in the heart contraction. And because of this increase in the heart contraction, this would ultimately lead to an increased blood pressure of an individual. So yes, certain emotions such as anxiety, such as fear, such as pain, such as stress, it can increase or it can lead the sympathetic nervous system to get activated. And once the sympathetic nervous system gets activated, it causes vasoconstriction. And when this vasoconstriction occurs, it will lead to an increase in the heart contraction, as well as this increase in the heart contraction would ultimately lead to an increase in the blood pressure of an individual. That's why it is said that certain emotions that an individual is going through can also affect the blood pressure of that particular individual. Then the third one, that is the gender. So here it is seen that after puberty, male will have higher blood pressure rather than female. So here, after a male has hit his puberty, then his blood pressure will be higher than that of a female of that same age group. However, it is seen that after menopause, then the female will be having higher blood pressure than males. So here, what happens is that after puberty, the males will have a higher blood pressure than the females, whereas after menopause, the females will be having a higher blood pressure rather than the males. And also, ethnicity is one of the factors that can also lead to a fluctuation in the blood pressure of an individual. So here we can see that the African American have higher blood pressure as compared to the European American. And also, people who are under the diet which is rich in salt and unsaturated fatty acids, can also have an increased blood pressure. Not only that, but even those who are under caffeine or under cocaine, is seen that their blood pressure will be higher. And even people who have the habit of smoking will be having an increased blood pressure. Why? Because nicotine will be present, right? This nicotine is the one which will increase the blood pressure of an individual. So ultimately, if an individual has the habit of smoking, then his blood pressure will also be increased. And then exercise. It is very important that you must always exercise yourself regularly. Why? Because if you do so, then this will help in keeping the blood pressure of an individual in a normal range. Then medications such as opioid, analgesic, antihypertensive drugs also have a greater effect on the blood pressure of an individual. So if you find any client who is under these medications such as the opioid, the antihypertensive, or the analgesic, then you can also see that there will be a fluctuation in their blood pressure. And then chemicals, right? Chemicals such as epinephrine, ADH, as well as angiotensin 2 can also cause vasoconstriction, and whenever there is vasoconstriction, this would ultimately lead to an increase blood pressure, right? So if a client is under angiotensin 2 or under epinephrine or ADH, then this can lead to an increase blood pressure. Whereas if the client is under histamines or kinins, then this will cause vasodilation, and if vasodilation occurs, then this would lead to a decreased blood pressure. So vasoconstriction will lead to an increased blood pressure, whereas vasodilation will lead to a decreased blood pressure. So these are the various factors that can affect the blood pressure of an individual. Now moving on to the next, that is the regulation of the blood pressure. So here, as we all know, that the vasomotor center has the main role in regulating the blood pressure throughout our body, right? So here the two receptors, that is the chemoreceptors and the baroreceptors, which are located in the arterial system, are the ones which will be very sensitive to the blood volumes as well as its chemical composition. So what happens is that these receptors, that is the chemo and the baroreceptors, will be sending impulses to the vasomotor centers, which can cause vasodilation or even vasoconstriction in order to keep the blood pressure of an individual in a normal limit. So again, as I've said, that this vasomotor center is the one which is responsible for regulating the blood pressure, right? So here there are two receptors, that is the chemoreceptors and the baroreceptors, which is located in the arterial system, right? So these two receptors are the ones which is very sensitive to the blood volume as well as its chemical composition. So what these two receptors will be doing at so what these two receptors will be doing is that they will be sending impulses to the vasomotor centers in order to vasoconstrict or in order to vasodilate, in order to keep the blood pressure of an individual in a normal limit. So as I've said, that if there is vasoconstriction, there will be increased blood pressure, right? However, if there is vasodilation, then it will lead to a decreased blood pressure, right? So here, if these chemoreceptors or this baroreceptor feels that the body of an individual requires the blood pressure to be increased, then it will send impulses to the vasomotor center in order to cause vasoconstriction. However, if these receptors feel that the blood pressure of an individual needs to be decreased, then it will send impulses to this vasomotor center to cause vasodilation. So this is the regulation of the blood pressure. So moving on to the next, that is alteration in the blood pressure. So under this, the first one we will be discussing about is the hypotension. So what do you mean by hypotension? Hypotension is also known as a low blood pressure. So as I have said that the normal blood pressure of an individual is 120 by 80 mmHg, right? So here, if you find that a client is having a blood pressure which is lower than the normal value, especially if it is under 90 by 60 mmHg, then this client can be termed to be having hypotension. And then the second one is hypertension. Hypertension is just opposite of what hypotension is. So hypertension, which is also a high blood pressure, is a common condition in which the blood pressure of an individual will be higher than the normal level. That means it will be higher than 120 by 80 mmHg. And also this is a very common condition in which the long-term force of the blood against the wall of the arteries is high enough that it can also eventually cause some health problems such as the cardiac disease or the heart disease. And when can we term a person, to be suffering from this hypertension? We can term a person to be suffering from a high blood pressure or from hypertension if you find that their blood pressure is 140 by 90 mmHg or above. The third one is the orthostatic hypotension or the postural hypotension. So here what happens is that if you see that when a client is standing or even when the client is rising to an upright position, that their blood pressure, is falling, then this can be termed as orthostatic hypotension or even postural hypotension. So let us look at the stages of blood pressure. So here there are 5 stages. The first one is the normal stage, that is when the systolic is less than 120 and the diastolic is less than 80, then it can be said that it is on the first stage, that is the normal stage. And the second one is the elevated. So here what happens is that if the systolic is between 120 to 129 and when the diastolic is less than 80, then it falls on the second stage, that is the elevated stage. And then the third stage is the hypertension stage 1. So here what happens is that if the systolic pressure is between 130 to 139 and the diastolic pressure is between 80 to 89, then it can be termed as hypertension stage 1. Whereas if the systolic pressure is 140 or even higher than that and the diastolic pressure is 90 or even higher than that, then it falls on the hypertension stage 2. And the last one is the hypertensive crisis. So here what happens is that if the systolic blood pressure of an individual is higher than 180 and the diastolic blood pressure of an individual is higher than 120, then this falls on the stage of hypertensive crisis. So these are the 5 stages of the blood pressure which you can understand just by the value of the systolic and the diastolic blood pressure. Then also, as I have said, right, that depending on the age, depending on the body size of an individual, right, the blood pressure of an individual can differ from one person to the other. However, there is the normal, the minimum and the maximum for each and every age group. So talking about the first age group, that is 1 to 12 months. So here the minimum blood pressure of this age group is 75 by 50, whereas the normal is 90 by 60 and the maximum is 100 by 75. So here if the client who is between 1 to 12 months, if you find that their blood pressure is lesser than the minimum or higher than the maximum, then you can term it as hypotension or hypertension. If the client is between 1 to 5 years of age, then their minimum blood pressure can be 80 by 55, their normal is 95 by 65 and their maximum is 110 by 79. And if the client is between 6 to 13 years of age, then the minimum is 90 by 60, their normal is 105 by 70, whereas their maximum is 115 by 80. And if they are between 14 to 19 years of age, then their minimum is 105 by 73, their normal is 117 by 77, and their maximum can be 120 by 81. And when we talk about the adults, then here if the client is between 20 to 28 years of age, then their minimum can be 108 by 79, whereas their normal is 120 by 79 or 120 by 80, and their maximum can be 132 by 83. For people between 25 to 29 years of age, their minimum can be 109 by 76, their normal is 121 by 80, whereas their maximum can be 133 by 84. And for those who are between 30 to 34 years of age, then their minimum is 110 by 77, their normal is 122 by 81, and their maximum is 134 by 85. And also for those who are below 35 to 39 years of age, their minimum is 111 by 78, their normal is 123 by 82, and their maximum can be 135 by 86. 40 to 44 years of age, their minimum can be 112 by 79, their normal is 125 by 83, and their maximum can be 137 by 87. And for those who are between 45 to 49 years of age, their minimum can be 115 by 80, their normal is 127 by 84, and their maximum can be 139 by 89. And also for those who are between 50 to 54 years of age, then their minimum can be 116 by 81, their normal is 129 by 85, and their maximum can be 142 by 89. And for those who are between 55 to 59 years, their minimum can be 118 by 82, their normal can be 131 by 86, and maximum can be 144 by 90. And for the last age group, that is between 60 to 64 years of age, then their minimum can be 121 by 83, their normal can be 134 by 87, whereas their maximum can be 147 by 91, and so on so forth, right? So here, this is just a brief example where I want to show you that depending on the age group, it is not necessary that you must only attain the normal value. However, there is the minimum and maximum as well. But if you find that your blood pressure is lower than the minimum or higher than the maximum, then this can show an indication that your blood pressure is not in the normal level. Then how can we monitor this blood pressure? We can monitor this blood pressure by two ways, that is through direct way or through indirectly. So how can you monitor the blood pressure directly? You can monitor it through an invasive procedure whereby you will be inserting a catheter inside the artery of an individual. So in this way, you will be able to get the value of the normal blood pressure. However, you can also monitor the blood pressure of an individual indirectly, that is through auscultation as well as palpation. And also from these two, the most preferred one is the indirect method, that is through palpation. Through auscultation, we will be frequently monitoring the blood pressure of an individual. So here, if the client is having low blood pressure, that is also known as hypertension, then these are few of the signs and symptoms that you can witness. They will be having dizziness, they'll be having a fainting sensation, they will be having a blurred vision, they will be dehydrated, so there will be an unusual thirst, they will be fatigued, as well as there will be presence of a rapid shallow breathing. However, if you encounter a client who is having a high blood pressure, or we can also say hypertension, then these are the few of the signs and symptoms you can see. That is difficulty in breathing, then this would lead to chest pain, and then there will also be irregularity in the heartbeat. There would be presence of blood in the urine, and also they may be having visual problems whereby they will not be able to identify or to see things clearly. And then there will also be presence of fatigue or confusion. So these are the few of the signs and symptoms that you can witness in a client who is having hypotension or hypertension. So here, as I've told you, that whenever you assess, whenever you monitor the vital signs of an individual, you must make sure that you record it, right? So why should we record these vital signs? We should do it because as this record is a legal document, right? As this record can be served as a legal document, then it will be able to protect the hospital as well as the client. We also document these vital signs in order to find out if there is any deviation, because as I've said that these vital signs are the basic indication, right, of the health of an individual. So by recording it, by assessing it every time, if there is any deviation, then we can find this out easily. And also, we as nurses, whenever we document these vital signs, we should make sure that we do it according to the policies as well as the procedures that the organization wants you to. These vital signs can also be documented on graphic sheet notes in case if any abnormalities has been detected. Why? Because if you document this in a graphic sheet, then it will be very easy for you to assess if there's any abnormalities or if there is any deviation. So if a client is having elevated body temperature, if a client is having tachycardia or shortness of breath, you must make sure that you document it. And not only must you document that you have found that the client is having this, but you must also document what are the actions that you have taken for that particular client. And also, vital signs can be documented in both the vital sheet as well as the graphic chart. Why? Because vital sheet is the one where you will be documenting all of this in order to serve as a record, right, so that you can refer. Whereas if you document it in the graphic sheets, then it will be very easy to find out if there is any deviation or abnormalities. So these are a few of the important points that shows us what is the importance of recording the vital signs. So now here we have come to the end of this session. So in today's session, we have discussed in detail about what do we mean by blood pressure. Then we've also come to know that there are two measurements, that is the systolic as well as the diastolic blood pressure. We've also discussed about the physiology of the blood pressure, about the regulation of the blood pressure, or about the factors that can affect the blood pressure of an individual, and also about the alterations in blood pressure. And at the end, we've also discussed about the various signs and symptoms that you can witness in a client who is suffering from hypotension or hypertension. And also we've discussed about why is recording the vital signs important. So I hope you guys have got a clear understanding of this session. I'll be meeting you guys in another video whereby I will be teaching you about the procedure which you need to follow while you are monitoring the blood pressure of the client. So until then, have a good day. Thank you.